দর্শকবৃন্দ, আমরা আছি আজকে থাইল্যান্ডের ব্যাংককে জিনিয়া ফার্টিলিটি সেন্টারে। কেন থাইল্যান্ডের ফার্টিলিটি এখন বিশ্বজুড়ে আপনার খুবই সমাদৃত এবং মানুষ সেফ ফার্টিলিটির জন্য কেন মানুষ থাইল্যান্ডকে চুজ করে। আমরা আজকে এখানকার খুবই স্বনামধন্য ডাক্তার, ফার্টিলিটি বিশেষজ্ঞ ডক্টর পকপং তার সঙ্গে কথা বলবো এবং ফার্টিলিটি নিয়ে আপনাদের যদি কোনো যে প্রশ্নগুলো সাধারণত এসে থাকে সেগুলো সম্পর্কে আমরা আপনাদেরকে জানানোর চেষ্টা করব এবং কিভাবে পুরো প্রক্রিয়াটা ঘটে সেই বিষয়গুলো আমরা আপনাদেরকে জানাবো। ওয়েলকাম ডক্টর to our programs. What is the process of fertility you maintaining, and what is the technology you are using now current days?
Right now, we have many level of the treatment
Yeah.
for the patient. That it depends on their condition, but the most that we focus on at this moment is about to do the IVF and also to do the chromosome testing. That will helpful to choose the good quality embryos, and also that everybody would like to get pregnant with a normal chromosome baby.
Yeah.
And right now we know that the patient get married quite late, and that's why the patient have a lot of problem to get pregnant, and also even they can get pregnant, the health of the baby is also important. So right now we try to introduce the most like state of the art of the kind of technology, the NGS, and combine with some special treatment for some patient who have a specific condition. For example, the abnormal genes. We also provide the PTTM for looking for the abnormal gene in the embryos they have and choose a normal one to transfer back to the womb. So in the overall, just like try to expand the chance of having kids, and also not only the get pregnant but also get pregnant with a healthy baby.
So IVF এর এখন যেটা হচ্ছে যে সিগনিফিকেন্ট উনি টেস্ট শুধুমাত্র আসছে IVF ICSI. So আমরা কোটা কি define what is the difference between IVF and ICSI?
Normally, when we're talking about the IVF, it's kind of the term that cover between the conventional IVF and the later technique ICSI or ICSI that you said. And the conventional one is mean that we put some number of sperm within the egg dish and then let them fertilize by themselves. So in that case, it's like the technique that we do in the past. And right now, most of the center move to do the ICSI or ICSI because we can pick the good sperm and inject directly into the egg. This can help to prevent the problem that sometimes the sperm is not good enough, cannot fertilize by themselves. And if we just put it together and after that we found later that they are not fertilized, we cannot do anything and we will lose the egg for that reason. So we move to do the ICSI so we can pick the sperm, and nowadays sometimes we see that the percentage of normal sperm in male partner becoming lower than usual. So this way it can help to pick the good sperm and inject directly, so it can like make you very sure that the eggs has been fertilized with the sperm.
It's also like the related of the possibility of the success also high in ICSI.
I have to say that if we're talking about whenever we have a good quality embryo, it's maybe not much different between the one that's come from IVF or ICSI, because at that time it's quite ready for implantation already. But there are some limitation for the IVF, because as you know that sometimes when we have to put a lot of sperm into the eggs, it means that it have risk of the contamination with the other sperm. So in a way, the patient would like to do the chromosome testing or PTTA, PTTM. We prefer to do ICSI because in that case we can make sure that the sperm, just only one sperm fertilized with the egg, so it have no contamination. At the time that we cut the cell, it have no risk for the contamination, so the interpretation of the PTT will be more precise, and when we compare with this factor, so we can select the better embryo and have no contamination, so the result would be likely to be better. But in the overall, if we just only talking about the good quality embryo and don't mention about the PTT, it's maybe not make that much difference.
Okay. Can you say us also like there is many fertility treatment in the world now, but why people will select Thailand and especially to Jinia?
I think Thailand is the best destination for some medical treatment because we have a high standard treatment in the world-class standard.
Yeah.
And also, you know that Thailand is a good place for your travel
Yeah.
also. So when you have the treatment, it's not
Mm.
only focused on the kind of treatment you receive, but also your mental health. So you can come here, you have like a lot of things that you can be relaxed and can have travel along with the treatment. You need not just only focus on the medical treatment. And from our standard from Genia, we adopt the technology from Genia Australia that has been working in the field of IVF for more than 30 years. And also we invented the machine for the embryo culture and also the media to culture the embryo until we have a research to confirm that the result is better than the general machine that used in the market. And also we have a backup team from Genia Australia to back up about the chromosome test and also the genetic team to give a consultation and also give the high standard check for the patient who are affected from the abnormal gene or would like to have a treatment for the PTTM also. And because we have a big data include from Australia and also in Thailand, so that data is very good thing that we can use and to analyze when we apply to our patients. So we think that we can choose the best shots for the patient.
তো যেটা উনি বললেন বিশ্বজুড়ে অবশ্যই থাইল্যান্ড সমাদৃত চিকিৎসার জন্য। এছাড়া একটা বিষয় হচ্ছে যে থাইল্যান্ড শুধুমাত্র আপনার চিকিৎসার জন্য না, থাইল্যান্ড ঘোরার জন্য, আপনার সময় কাটানোর জন্য অবশ্যই ভালো জায়গা। সো এই ধরনের লম্বা সময়ে ট্রিটমেন্টে যখন আপনারা আসবেন, অফকোর্স থাইল্যান্ড ইজ এ গুড মানে ভালো জায়গা, প্লেস ফর আপনার নিজেকে সুস্থ রাখার জন্য। Could you tell us, like, if someone like wants to take the, if some couple wants to do the treatment, the fertility treatment in Thailand, what kind of the like preparation they need for their mentally when they want to take this kind of long treatment?
I think the most important is like when they would like to make the journey of the treatment in a quite smooth and in a good way. They have to know their own factor. They have to know their own limitation and set a very good or proper expectation. That's very important because we know that the patient that have the problem of fertility, they have a different level of the difficulty of their problem. So initially, I would prefer them to have some investigation, maybe like from their own country and under our guidance, so they can provide the information to us. So before they come here, I think there's some way that we can improve the chance of their like the outcome of the fertility. So when they come here with a good preparation, good expectation, and understand about the treatment they will receive, is maybe good for the mental health, and they will pass this journey easily. And I don't think that will be much difficult for them.
তো উনি খুবই ভালো একটা কথা বলেছে আমার মনে হয়, যে এটা আপনারা এইখানে আসার আগে মানে থাইল্যান্ডে আসার আগে আপনারা যদি বাংলাদেশেই কিছু টেস্ট করে রাখেন, যেটা আপনার জেনারেল টেস্টগুলো মানে ফার্টিলিটির ক্ষেত্রে, তাহলে আপনারা ওই ডকুমেন্টসগুলো যদি ওনাদেরকে পাঠান, তাহলে সেক্ষেত্রে ওনারা এটা দেখে আপনাদেরকে বলতে পারবে যে আপনার বর্তমানে অবস্থা কি, এবং আপনাদেরকে একটা সম্যক ধারণা দিতে পারবে। সো মানে ওই আইডিয়ার উপরে ডিপেন্ড করে তখন যদি আপনারা এখানে আপনাদের প্রিপারেশন নিতে সুবিধা হবে, যে আপনার কতদিন থাকতে হবে, কি ইয়েতে থাকতে হবে। সো ওই জায়গাটা আপনারা আগে থেকে মোটামুটি জেনে তারপর আপনারা যদি আসেন, সেটা আপনাদের ক্ষেত্রেও সুবিধা হবে। Can you tell us the process for how many times patient need to come here, and in a few words?
For the IVF or ICSI itself, it have two separate major steps. The first one is to create the embryo, and the second step is to transfer the embryo after we have the result come back that we have a qualified embryo to transfer. So the first step, actually we can start on day 2 of the menstrual cycle, and this majorly will be the injection to stimulate the eggs to grow that lasts for about 10 days by average. But you know, in some patients may take a little bit shorter, a little bit longer. It depends on their follicle or the eggs development. And after that, we have just a small procedure to aspirate the fluid, the eggs out. And after that, they can go back home because then will be the step in the lab to create the embryo and update to them by the email. And also, we have a special thing that we can give them the link so they can get into the link and can see the embryo by themselves also. No need just only rely on the written information. And after that, when they have the good quality embryo to transfer, the next step will be the step to transfer the embryo. At that step, just only taking the medicine at home for the first 2 weeks, and then we evaluate until it's be ready for implantation. So we just support the patient back on the day of embryo transfer, and they may stay just only a few days after transfer. So for the second part, we'll have a shorter period of stay. For the first one, may take around 2 weeks, but for the second one, maybe less than 1 week. Depends on how they preparation and also like how the
আমার মনে হয় যে এটাতে একটা ছোট্ট ধারণা পাওয়া যায়। আপনারা যদি দেশ থেকে প্রথমে আপনাদের পেপারস গুলো পাঠান, ওনারা দেখে আপনাদেরকে বলবে যে কবে আসতে হবে। ধন্যবাদ। থ্যাংক ইউ ডক্টর, থ্যাংক ইউ।